It's a privilege to service the independent doctors. We love playing that role of helping the underdog. We're in bed with them. If Dr. Smith loses a patient, we lose a patient. We have the ability to look at thousands of practices. We clearly understand who the most successful are from a commercial standpoint, and it's very clear what those practitioners are doing, those practices are doing to be the best at what they do. If you're a practitioner that knows you have to make a change with your staff, make it today. The staff is critical. The staff is critical. More important than the doctor in most cases, believe it or not. And staff training is critically important. You feel it the second you walk into a practice. It's not just optometry we're talking about. You have that same feeling within all different types of retail environments. It can be a restaurant, it can be a clothing store. You know the second you walk in, it's a world-class operation. The employees are engaged and are concerned and want to help the consumer in those particular cases. I had an experience the other day, came in, was taking a practitioner out to lunch, walked in, no one came up to me for 10 minutes. The reception area was towards the back, and those people were buried down in there doing their business. Just in case, I walked out assuming, well, let me start this over again, did it again. Had a very interesting conversation at lunch with that practitioner about maybe how his staff could maybe make some changes. Things are fundamental, very fundamental. Customer care, paying attention to what the customer needs. When you walk in, the first several seconds, that customer is making first impressions, which are critical to patient retention and the growth of the practice. There's different types of practices throughout the country. A lot of geography dictates different types of practices. But whatever that value proposition is that you've decided as a practitioner to deliver, make sure we're communicating that correctly to the patients. And developing that value proposition that that practice knows exactly what value they're trying to promote, and they make sure that the patient understands and gets that message clearly communicated to them at the practice. I take your insurance. You're not going to have to do anything. What practitioners do, they deliver very well. We don't take this insurance plan, that's bad news, but they don't communicate the value proposition of not only do we accept your insurance, but we're going to do all the work in order to get reimbursed on your behalf. But we're not communicating it as a added value and that's one of the critical things why that patient picked that practice to begin with. Have a plan on how you're going to communicate your value-added proposition within your practice. The new currency today is time. It's very clear that everybody's talking about affordability when the consumers can't afford the time. So it's critically important to expand hours of the practice, and it's critically important to get that patient in and out within a given time. What our research shows about an hour. If you're behind, those are things that are costing the consumer money. They're working, they in their minds have decided that they should be in and out within an hour. Number one reason people don't get more eye exams, they can't afford the time. So you got to carve out an afternoon or morning a week to work on the things that the practice needs. Everybody has to invest in becoming better. We have all different types of success stories of independent optometrists opening practices and becoming very successful. It's certainly about clearly developing that value proposition, caring, being integrated with the community, and making a difference.